just to work and serve and make a difference in the lives of the children and the families that we have the honor and privilege of serving. That brought me to System of Care.
In our case here at Community Mental Health in Saginaw, we've had a long culture of involving kids and families and just customers in what we do. I mean, they're on all of our standing committees. All of our committee process across our agency as we do our day-to-day work opens with what are our core values and operating principles, and a part of that dialogue is always our customers. So in the case of kids and families and System of Care, it wasn't a big stretch for us to say, oh, okay, you know, family-driven planning, family-driven care, family-driven treatment plans, that's already a part of our culture.
Each and every member of this staff gets it. There are families who are actively involved now whose children have aged out of the system, but they're so committed to the work that we do that they come. And once the child has aged out, you can say, well, they're getting a stipend, they should, but at a certain point there's nothing there. The reward is, I'm here and I'm making a difference.
One of the benefits to me in the court has been the ability to have some of those trained parents who know how to talk to people within the system about what the needs are come from the System of Care table to my table.
Bringing a mom and dad, bringing a family to the table to hear their voice is one thing, but training them so that their voice can be heard and respected, now, you know, that's another matter altogether.
There is no other one group of people or person that can speak for a family like a family.
Here at System of Care, we have System of Care planning teams, and those teams could be social marketing, cultural linguistic competency teams, anywhere in our implementation and review teams, coordinating counsel. So when I took on the position, I looked over all of those teams where family voice can be heard, it can be respected. And I made sure that families knew that they were safe to use their voice and to tell and talk about their stories somewhat in a more safe environment, and to be respected as a round table, that everyone there we're just here to help families.
How powerful it is that families are reviewing policy for these system partners, and with a real voice. We're not going through the motions. With a real voice and making recommendations for change that are being very, very seriously considered and whenever possible honored.
So I think this idea of a family-driven system of care that's informed by a youth voice is something that has changed everything.
We learn that it takes constant work, effort, reassurance. It takes for people like me shutting up and listening. It takes our willingness to really go into the communities, not to sit back in our offices, but go into the communities and be there.
I know what it's like to be on the other side of the fence, or the other side of the door, or the services, or whatever it is. Being on the other side is a very uncomfortable place. And we forget how it used to be. No one on this staff forgot.
Keeping up with me, checking on me if I'm at home, you know, being concerned. It just made me feel so much better. The CPS workers were just always picking on you and at your house constantly. I have had them come to my house at 9:30 at night. It was just horrible. But working with System of Care, those feelings and stuff start decreasing.
Everyone has a story. There's something different for each of us that enables us to come together and put our minds and hearts into everything we do and every decision that we make, so that a family will reap the benefits.
We have youth who have already gone through the system, gone through different barriers, that they have an opportunity to say, you know what, I can now turn and help pay it forward.
Some really great things are happening. We have challenges, but we're just meeting it. We're standing toe to toe, and we are going to save our children in this community.
We just don't have meetings to be having meetings. Our mind is to go out and reach Saginaw.
With all the challenges out in our community, this is what's going to make the difference.
I started to want to work, and I was feeling better. I felt like there was, like I was needed, you know, and that there was hope that for my son I could make a difference. You know, he wouldn't have to go through what I had to go through growing up, and you know what I experienced.
I just really appreciate System of Care hiring me and believing in my voice, and you know that I can make a difference and be a change agent.
I'm just really proud to be here now in Saginaw, serving in this capacity.